Good evening, my name is Richard Cathcart, and I want to share with you why I am participating in a clinical study of Degarelix, a drug which is used for the management of non-metastatic, that is not well pronounced, hormone refractory prostate cancer. That's where I'm at the moment. Why am I participating? Because the prostate cancer that was the one I was diagnosed with 16 years ago is no longer responding to the hormone treatment. I have what is termed hormone refractory prostate cancer, HRPC. As a result, my PSA is continuing to rise. Background. Upon diagnosis in 1995, my PSA reached a level of 98, and I was immediately put on a Lupron, or Zoladex, it came later, which is a partial androgen blockade, covers 90%. There's a small amount that has also dealt with things called Cathcart. It's then total androgen blockade when combined. This brought the PSA down from the 98 level to 0.2 for the last 15 and a half years. But about 8 months ago, my radiation oncologist detected through a PSA test that my PSA was going up and had reached not alarming levels, but we were at now 13. Going from 0.2 to 13 is a fairly significant rise. However, in the last 8 months, that suggested to him that maybe I should go on something new that's being researched at the moment. And I am participating in a clinical trial managed by the Ottawa Regional Cancer Centre, and I go to the center at the General and have my dealings with Dr. Eapen, who is my radiation oncologist, and I have the shots. I don't know how many of you have Zoladex or others. They're rather significant shots. I was taking Zoladex long-acting, which was every 3 months, and this Firmagon, which is the brand name of what I'm on a clinical trial taking, is similar to Zoladex, but my speech will probably tell you a little bit more about why I'm on it and how it's going to help, I hope. Firmagon, spelled F-I-R-M-A-G-O-N', has advantages. It has superior tumor control, and there's less PSA failures, longer PSA progression-free survival, greater, some of these acronyms I have no clue what they are, but control, and better FSH suppression. Patients switched to Degarelix, or Firmagon, same thing, from Leuprolide, which is Lupron or Zoladex, to Degarelix, after 1 year experienced improved hazard rates for PSA failures or death. Good to know. Hazard rates for continuous Degarelix or Firmagon patients did not show any significant changes, which means things improved. The next expression is one I find difficult to relate to. Longer time to castration-resistant disease. So there's one of the advantages. I was thinking I would go into some of the more technical aspects, but it would be very hard to explain them. If you did ask me, I wouldn't be able to tell you. But there are many, and it's one I'm undergoing at the moment. I have completed 5 of 6 months. As long as I stay on this program and make some improvement, I will maybe continue because my PSA is not going away. It's very obvious. As more by way of adding information on the background, what we're doing with HRPC is that the usual treatment is either the addition or withdrawal of an anti-androgen, a drug that inhibits testosterone production, to your hormone treatment known as hormonal manipulation, which is a technical term. A hormonal manipulation will temporarily stop the PSA from rising in about 10% of men with HRPC, that's hormone refractory prostate cancer. There are currently no other accepted treatment options for men with non-metastatic HRPC. Eventually, all HRPC will spread to other parts of the body, metastasize, at which point you may receive additional therapy, which may include chemotherapy, estrogen therapy, and antibody-based therapies. Degarelix, or Firmagon, is a new type of drug for prostate cancer that, unlike other hormonal therapies, stops prostate cancer from growing by binding to receptors in the pituitary, a gland that secretes hormones necessary for prostate cancer growth. Health Canada has approved the sale and use of Degarelix to treat advanced prostate cancer. And I am participating in a study. There are approximately 40 patients participating. I'm one of the 40, and the coordinator of the research is Dr. Shawn Malone at the center. I've never spoken to him, but he's certainly written a lot, and I got much of what I've read is from his speech to the Montreal people on what he's doing, and so I'm sharing what information I can on that with you. And I can't give you an update because my final test results are not yet in, and I will be sharing, my Libni Eapen will be telling me probably around December 19th when we're having a meeting for that final period, because if I don't have any improvement in the 6 months, I'm off. It has to work, and I don't know what the situation is. So I will be looking forward to our meeting with him and finding out how that will proceed. I am open, of course, for questions, if any of you have them, and David has one.
Good to see you again, Richard, as always. Side effects to this new drug. Are there side effects that are different than what you would have had with Zoladex or Zoladex?
Somewhat similar side effects. There's certainly, I jokingly refer to it as a not an incision, that would be far too heavy going here, but there is a rather large needle goes in subcutaneously, and at that site they have to leave it in for 30 seconds so that it can connect properly. And there's usually a lump there or redness, and because it's at your waistline, it's not terribly comfortable, but it goes away. I don't mind if it kills me, in the sense that I don't mind if it does it, as long as it does the job. And that's what I can answer on that subject. Yes, sir.
If there's a mic, if you speak on the mic.
Thank you, Richard. I'm taking Eligard injections now. I get one every 3 months. And I'm just curious, is the Firmagon something that you would use instead of something like Eligard, or only if the Eligard refractory situation happened?
I don't know the name Eligard. I know Zoladex and Lupron. If they're the same, Firmagon is a sort of replacement for.
Replacement for, but not specifically if another hormone treatment fails, then you would go to Firmagon?
Well, that's exactly. If, in my case, the Zoladex was failing, so I'm on Firmagon. And Elgar, if it was working and failed, it may be suggested that you go on Firmagon, which is I'm part of a clinical trial to sort through some of the side effects and other things.
Okay, thank you.
How long does it take for the lumps to go away from your after the injection, or do they go away?
Well, they take a long time. One lump has never gone on, because I don't know, people here who take Zoladex LA or anything like that knows that they change sides, the location has to be rotated, and you have to be very specific. When did you have it? And then, it's usually given to you by your GP or something. And but Firmagon leaves a bit of a lump. It's not very hard to take. The redness or the feeling, the hot feeling there, will take a couple of days and goes away.
But how many lumps do you have still left over from?
One. And it's gone away. It was from the third injection I had, and that's pretty well gone.
And you didn't cheat by going to a GP and getting a PSA test and see what it's doing?
I tried to cheat, but I haven't had the results yet.
Do you get hot flashes?
Yes. All the same things that you get with Zoladex or any of these, any partial androgen blockade. The Cathcart, which brings it to total, I actually this is a long time ago now, when I was first diagnosed, I was put on Cathcart or its equivalent, I'm not sure what the name was, to bring it up to 100%, from 90 to 100. And I had headaches and things, and so the doctor told me to discontinue. And I haven't had it in 16 years. I have not had to have this extra coverage going from partial to total. And so I cannot advertise that much.
Thanks.
Thank you. Just a point of clarification. You had your diagnosis and then you've been getting hormone injections up until for those number of years, or did you have any surgery or radiation or anything else?
When I was diagnosed in 1995, as I started, my PSA was 98. The option of prostatectomy was not on. Dr. Morash did a lupronectomy, and he had the lymph nodes examined on the operating table, and they were cancerous. So no way. He couldn't proceed, because theoretically he could have then removed the prostate. But it's like trying to get after the cows out of the barn. There's nothing to be done. So this meant that the lymphs had already had the cancer. And so I couldn't have an operation. Radiation wasn't even on because it's rather widespread. You can't target the lymph nodes very well. So that's meant that the options were very limited to partial androgen or total androgen blockade, and the hope for was that would result in controlling. You can never eliminate.
Okay. Thank you very much.
Anybody else? I don't know if did you answer the question about what are the side effects that you're experiencing?
If I can elaborate, the side effects I still have, whatever Firmagon or Zoladex, are hot flashes. I have fatigue. I have, of course, in effect, I've been chemically castrated. There's, it's testosterone is 0 and it remains that way. But I don't have any of the problems associated with a prostatectomy. I don't have any other problem that, except I guess occasionally the bladder is control is not as good as it could be, but it's not a desperate situation.
Anybody else?
I'm glad to have had the opportunity to speak. Thank you.
Richard, on behalf of, where are we? We got PCC in Ottawa, yes. There are some very brave people who come to these meetings, and to get up and speak to these other folks about what you've gone through is a particular kind of courage. So on behalf of everybody, thank you very much. Here's a nice tie, which doesn't go with the green, but it's Christmas time, so it doesn't matter.